Like radon, trichloroethylene can evaporate from soil and water and pollute the indoor air of homes, schools, and workplaces. To discuss the effects of air pollution both inside and outside on brain diseases is our first panel. Jennifer Hijazi, a senior Bloomberg reporter who covers air pollution and climate change, will moderate. Jennifer.
Thank you so much, and thank you to our panelists for being here today. We've got an amazing array of folks who've been doing really incredible work at the forefront of pollutants and toxicants. And I want to introduce Deborah Cory-Slechta, who is a University of Rochester professor specializing in environmental medicine, neuroscience, and pediatrics, who's led extensive research on developmental exposures to environmental chemicals and their impact on brain and behavior. And Kari Reinhardt, next to me, is an advocate in Franklin, Indiana, working to unveil the connection between TCE and pediatric cancer after her daughter, Emma Grace, died of a rare brain tumor. She's the co-founder of If It Was Your Child, a group dedicated to investigating the cancer crisis. And Michele Roberts is based in Wilmington, Delaware. She has been a community environmental advocate for 25 years, aiding grassroots efforts on chemical reform, and she is currently a member of the White House Environmental Justice Advisory Council. So I just want to start with a round of applause for you all. Thank you so much for coming. Before we get into the nitty-gritty of cumulative impacts and community exposure literacy, I really want to start with your stories and how you got started with the work that you've done. You've been at the forefront of really incredible work, and I wanted to get a brief overview of your journey and some of the work that you're doing now. Whoever wants to start.
I can start. I actually started my career working on lead exposure in children and in animal models many, many years ago. And I think one of the things that became really clear to me in that work, we had a prospective cohort study going on, was that the moms would come in and say, I can't pay my rent, I can't pay for childcare, now I gotta worry about lead exposure, what do you want me to do? And going back and looking at my animal model of lead exposure, you know, a mouse in a cage or a rat in a cage, and saying, this isn't anything like the human situation. We have to start looking at these things more realistically, more translationally, and starting to study stress in addition to lead exposure, things like that. I'm lucky enough to be at an institution where we have a facility that allows us to generate air pollution exposures, pulling in outside air or making our own kinds of air pollution. And I got into that also about 10 or so years ago. And so I've been very interested in the impact of air pollution, both on early periods of brain development, but neurodegenerative diseases as well. I'm interested in, and I think we haven't done enough work on how pesticides may be carried by air particles, how far, and some of those kinds of questions. So that's sort of my story.
Thanks so much.
My story began with my family. I'm originally from Wilmington, Delaware, and I'm based in Washington, D.C. Like Joe Biden, I have a dual residency. And like Joe Biden, I came to Washington, D.C. to work for the people that many of you don't see, like my family. I appreciate your story, Michele, the tale of two stories. I, too, am a scientist. I, too, actually work for the federal government as a environmental scientist, as well as local and state. My family story, and many other families like the communities that I come from, my parents were part of the Brown versus Board of Education. They were Wilmington, Delaware, plaintiff state, in case you didn't know. My aunts were domestic workers. My one aunt was a domestic worker who also worked for a separate but unequal bomb-making facility. So the Rosie the Riveter story is slightly different too. There's different stories in different ways and different things. I'm a proud graduate of the HBCU Morgan State University. Those institutions were created to actually address some of these racial systemic issues that impacted us as a society. Being from Wilmington, Delaware, I am a child of the free people, if you will, as Bishop Spencer reminded us, and many of our folks in Wilmington, Delaware reminded us we were above the line, right? Where we fought against ourselves in the Civil War. All of this is very important because what I learned in school was how slavery was the forerunner to chemicals that actually, when you didn't have the free society to pick your fields, then you found chemicals. And actually, that's another part of the story, right, Michele, that we don't tell. And that's the part of the story that we're asking EPA to amend itself to tell, especially since our dear president now has the moral and political courage to center environmental justice into the federal family. So I come as a person who actually I'm the coordinator of the Environmental Justice Health Alliance for Chemical Policy Reform. Long word, long title, excuse me. But that was coined by our communities who are legacy communities, who live fence line and actually are part of where you, where it's made, stored, manufactured, disposed of, and all these things. And we are also a strategic ally of the Coming Clean Network, and that also a strategic partner. And it was because of TSCA that we became a strategic partner of the Coming Clean Network, where we seek to radically reform TSCA, hence our name, the Environmental Justice Health Alliance for Chemical Policy Reform. It's such a pleasure to be here and to have our communities with me as well.
I'm Kari. I didn't fall into advocacy until about a year after Emma passed away, when we found out that there were sites of concern around where we lived, and that there were a lot of kids. And when we started to put the kids on a map, literally the dots began to connect, and a local reporter brought to our attention that there were sites of concern, and that's how I kind of fell into advocacy, and I guess the cliche mama bear came out and just kept going.
I think something that you all have touched on that I do a lot in my own work as an air pollution reporter is community exposure and data literacy. And it relates a lot. I've been seeing a lot of federal pushes for instance, in the airspace, hyperlocal air monitoring, funding and grants for communities to fill in the regulatory gaps, because this type of monitoring is not required under the Clean Air Act, for instance, and actually gathering the data themselves to create dashboards or what have you to expose or to inform their community members of pollutants in real time. And I'm wondering where you all see in your work the strengths, and I think more importantly to identify the gaps in, like something that you mentioned earlier, like data literacy and actually telling people about what they're exposed to, rather than just like, handing them a sheet of very complicated Excel sheets full of numbers and exposures, but really helping them understand the context of their exposure and the environmental harms. And maybe we can start with you, Kari.
It was very surprising, I think, as it all evolved getting into it. I was surprised to see, I think it's very important to know how you present data to the community. I am a nurse. I'm not a scientist. I don't do, this is not my world. This is your world. I fell into this world, and I was shocked to find out how, to me, sciences should be science. It's science of science. But the way data is presented across the board and not necessarily presented truthfully, is shocking. And a good example would be a state regulatory agency came in after we had had an environmental engineer do vapor intrusion testing into a home of a man who had lived there well into his 80s. His son had a autoimmune disease, a prominent member of our community who required an organ transplant because of that autoimmune disease, likely caused by his chemical exposure, and most recently was diagnosed with kidney cancer as well. And when he received back his report from the state environmental agency, the cover sheet said, "We're happy to report to you, we found nothing above the maximum contamination limit inside your home." But then when he had me look at the report and I started going through the data, I started seeing all of these insanely high numbers for TCE in his sewer cleanout, 900 times the residential limits. And so what they didn't tell him, and what we later found in all, by we, I mean what was later discovered in these homes around our town, was that every time you flushed the toilet, the sewer cleanout was allowing vapor to come in and expose you to TCE and all the other contaminants that were in our sewer lines at 900 times the residential, and some of them 500 times the business limits, the limits you could have. And yet they put a cover sheet on this man's results that said, "We're happy to tell you your home is safe," and handed it to him. This is something that happens in the academic world. This is something that I've seen in the regulatory world, in the scientific research world, and this is unacceptable for you to present to a community.
And that's also, I think, speaking as a journalist, also a media literacy responsibility. I mean, we do our best to, many of us do our best to, be effective communicators, but, not all of us, myself included, are science communicators, for instance. So there are a lot of gaps that need to be filled. Did either of you want to jump in, Michele?
Yes, we spend time with our communities going through data. Let me start with one thing, risk assessment. Do you know how a risk assessment, who they base a risk assessment on? It's not children. It's not sick people. It's a healthy white male. Is it still that way at the EPA? Did we change it? We changed it. Thank you. That's a win.
That is a
But up until the point, it was based on a healthy white male. But yet you're subjecting children, pregnant women, and others, and we're learning this information, and we compile this data, and we go, and our communities get all excited. We have the data. We're going to take it and have a discussion. We're going to make effective change. And then we're told, no, it's your lifestyle. This is not the case. It's your lifestyle. These are the professional people who were in the state, and I'm not saying all of them, but this is what we are confronted with when we do this with our communities. And we even, and then our communities continue to educate themselves. And then they go and they're like, oh, well, it's our lifestyle. They tell them it's your lifestyle. You must eat right and drink, do all the right things, but you continuously get sick. And then here's all of these other tests, and then all of these other reports, and so on and so on and so on. And then we get to the policy part, but it's going to take us some time. Meanwhile, 80,000 plus odd chemicals are proliferating in the market that have not been fully tested, registered, what have you. But we're going to get there. Our communities, that's where our communities, in no disrespect to those who felt they did a wonderful job to the Toxic Substance Control Act, I'm here to say this is where you failed the communities who live fence line to these places and spaces. This is where you failed the communities who have what we call hot spots, pollution overload. As our president said, people who are living in pollution, marinated in pollution, smothered in pollution. And so we have a lot of data, and we educate our communities, but there's a disconnect in getting to the regulatory policies that fix them. And we are all about air monitoring and all of that. We need these things, but we also need to have the moral and political courage to get us over the hump to that policy that's going to provide the remedy and redress.
Yeah, it's interesting to hear this. I would point out that in many of the academic programs I'm familiar with, there really isn't any education on science communication. There aren't really internships or programs that would take a student out to these communities so they can make that kind of connect. So I think something like that would actually be really helpful. I can tell you a lot of students are so engaged in studying what they consider mechanisms that they don't see the bigger picture of what's going on. Many of us students in our program go into places where they do risk assessment, and that's really their first introduction to how risk assessment is done. It isn't part of a standard curriculum in many of these kinds of programs. So there is this gap, if you will, in going from the basic science to the impact, the ultimate impact.
And I think this feeds well into something that we were discussing earlier this morning, Deborah, on cumulative impacts, and not only disseminating what cumulative impacts mean for communities, but also how to galvanize policy and regulatory work around cumulative impacts, which, at least from a Clean Air Act standpoint, is not always an easy thing to do. I mean, you target one pollutant from one facility, especially from like an enforcement angle, and that's the basis of a citizen suit. But looking at, say, disparate impacts or cumulative impacts is really, it's a tougher bar to reach. And I wonder if, Deborah, you can talk a little bit about cumulative impacts research and how we can better communicate and kind of contextualize all these disparate impacts and galvanize more grassroots movements in that way.
So this has been something I've been, as I said, striding about for a long period of time. I do many risk assessment panels for EPA. We have 30 PhDs sitting around a table talking about the risk for a single chemical exposure. Even though we all know, and EPA knows, that you're not exposed to a single chemical, you're exposed to multiple chemicals and non-chemicals at the same time. They act on, many cases, the same physiological systems, the same target sites. So clearly you would expect them to have interactions. We're spending a lot of time now talking about the exposome and things we're exposed to. To me, the hard question is, which ones, when they come together, are problematic? How do we generate algorithms to ask those questions? Because then we can go in and say, oh, we know that these two together are bad actors, or this one, when it's in combination with this one, is particularly bad. And doing that kind of cumulative risk assessment is going to require a lot of thinking and consideration. There was an NAS document, a National Academy of Sciences document back in 2010 that began the process. It was sponsored by EPA saying, well, phthalates, should we study phthalates cumulatively? And of course the answer was, well, yes, they basically do the same thing. So it's like having, multiple exposures to something doing the same thing. And we talked about an algorithm where, because we've studied chemicals individually for so long, and we know what individual chemicals do, if I'm concerned about, I can start from a disease, let's say it was Parkinson's disease, I can already identify 5 different chemicals and non-chemical stressors that I know are associated with Parkinson's disease. That would be an obvious first mixture to begin to look at. So there are ways to start thinking about this question. I know EPA has efforts in that direction, but it's been painfully slow, and I think just focusing on what we're exposed to isn't going to get us to the promised land.
And I think a lot about, like our big push for carbon regulations for power plants and singular pollutant, big regulatory pushes that, I feel like a lot of my sources and folks that I've talked to are like, well, if we regulated more holistically, it would kill many birds. Well, I don't want to kill any birds. You get what I'm saying. And it, I think that also goes back to something we touched on a little bit earlier and a little bit in the keynote, but educating folks about the constraints of laws and the gaps in these laws that we've had, like the Clean Air Act, that hasn't been updated really substantively since the 1990s. And we've got so much incredible research, a lot of it from many people in this room, that is not quite keeping pace, or I guess I should say the laws are not able to keep pace, especially with lawsuits coming in and out from industry stakeholders and things like that. And I kind of segueing into something, Kari, you spoke about a little bit this morning on dealing with local regulators and federal regulators and the constraints inherent there with talking to folks who are new in an office, or can you talk a little bit about those challenges?
Dr. Freehoff kind of hit on it. Knowing who to ask as a community member, who to ask what to do for each problem, because often I would hear people when we would first approach things, well, why don't you just tell the mayor to clean this up? Have the mayor, why isn't the mayor fixing this? Well, it's not that easy. Why doesn't so-and-so do this or so-and-so? And explaining to community members that, especially in government, you're looking that people have a box that they can operate within, and your ask has to be something they can do within that box. So you can be most successful as a community member if you can work with that person inside, and your ask is inside the box that they can work within. That you can't make someone in government, the mayor of Franklin cannot clean up a water plume, a contaminated water plume that he didn't put there, and he has no authority to do so. So that's not in his box. That was kind of a really hard thing for the community to grasp, and even myself learning that was really tough to navigate. And there is no one to teach the community. There's no one to show the community. There is no liaison for the community besides moms. Overwhelmingly, the thing I ran into were moms. Over and over again, it's moms.
Yeah. And Michele, I feel like a lot of your work probably centers on providing that liaison.
It does, and I want to take us to that cumulative impact piece again, because for us in the environmental justice world, and in fact, we should be thanking the movement of environmental justice for pushing that of cumulative impact, right? Because it was about the chemicals, yes, but it was also about addressing the disproportionate impacts on our society. It was also talking about how our communities, because of racial redlining, were not able to move into certain spaces and thereby may have, unfortunately, God forbid, and I'm thinking about the numbers of them, may have had to have their homes built on top of those woe-burn sites. There are many that we don't know about. It is also about how we force migrated our Native Indigenous brothers and sisters off of the lands that they were calling home and putting them into spaces and places, and then putting dangerous extractive operations around them. So all of these things are what we consider to be cumulative impacts that affect our very way of living and our push to be able to be made whole. I think we really need to have this, and I'm very respectful and appreciative of being part of this process. But what I hear, and when I hear these tables being set with these PhDs, and they're wonderful, we have wonderful PhDs, but we also are earning our PhDs in the street because we're living through this daily, and we're living through this in legacies and our communities. Like I told you, my great aunt, Loretta White, God rest her soul, was born in the 1920s. My great aunt, like I said, I'm like a Sandra Steingraber, only I was not adopted. My uncle and my aunt. My uncle had brain cancer. My aunt had urethral cancer. These are because of the inequities of the ways in which they were subjected to living. And so this is where we appreciate, at least while we're trying to address these issues right now, in the Biden administration, through the White House Environmental Justice Advisory Council, how we address the inequities of environmental justice and that climate crisis on top of it, and that of the COVID crisis on top of that, and all of these other illnesses on top of that, and the mayors who are telling us that they can't do whatever because of that. You understand where I'm going with this? And the failed schools and the Brown versus Board, and have we cleaned up the schools since the Brown versus Board? You with me? This is what cumulative impacts means to us. Now, I might be sounding overly, some would say, oh, she's the angry black woman. Yes, I'm angry. I'm angry what we have done to our poor brothers and sisters, our poor white brothers and sisters, our people of color, our folks that we don't even acknowledge until we acknowledge them in a study because it's disproportionately impacted. Let's create the table. Let's write another report. But where's the policy? And I know that it takes time. Believe me. We just celebrated 70 years since Brown versus Board of Education. Do you realize that the states, and this may be separate and different, but it's the same. These states told the federal government what they weren't going to do. Just like with the health care piece. We have got to have the moral political courage to go very deep into making sure that we take care of the very least of these. And I know it won't happen overnight, but that's why I left the bench. And no, I didn't leave the bench willingly. The system told me to leave because I was asking too many questions. Because I was being told that I had to go in to a facility, I had to give them a courtesy call before I came. And I refused to give a courtesy call before I came. I'm going to leave it here, but I'm just asking us to really honor, what is before us. We have a challenge, but the challenge is how moral and politically deep are we going to go to make sure there is no harm, that we don't have risk assessments, that we do have cumulative impact analysis in these things, that make sure that we are prioritizing cleanup and prioritizing change and prioritizing a systems change. We can't center environmental justice into the White House and live more of the same.
Before I go into any other questions, I just want to encourage that round of applause. And make sure we're okay on time for questions? Okay. Then I want to go into something that, Deborah, you mentioned in our chat this morning too. You gave me this quote, how much health are we willing to give away when we talk about, I think we were talking specifically about like the European model of like exposure versus what the U.S. is willing to, I guess, sacrifice in order for new things to be on the market. And I'm wondering if you could expand a little bit on that.
So the Europeans operate by what's called the precautionary principle, which basically says, you know, if there is harm, this chemical will not go on the market. This may be a somewhat jaded view, but for many, having done risk assessment for many years, I've always felt that EPA operates from a how much of our health are we willing to give away? And I think I learned that early on in what were then CDC discussions of what levels of blood lead were safe for children. And you would hear discussions about, well, you know, we can leave it at 10 micrograms per deciliter because that's only 1 or 2 IQ points. So, you know, if you translate that, it's like, okay, 1 or 2 IQ points, no big deal. So to me, it's kind of how much health are we willing to give away, and I recognize that this is all done in the context of, you know, the economic and political and other considerations. But again, it's a very different way of thinking.
And with that, I think we can probably open it up to questions now. So somebody is walking around with a mic, right? Okay, perfect.
Talk a little bit about the effects of outdoor air pollution. Increasing research has linked this to Alzheimer's disease, to Parkinson's disease. It's a huge issue for all communities, but it's really undertold.
I totally agree. That literature is accumulating so fast, it's phenomenal. I think the thing about air pollution studies, you'll see now a lot of meta-analyses that are relating air pollution both to Alzheimer's and to Parkinson's disease. There's so much we don't know. I think your slide showing what's been done with air pollution research, is it because it's a lifelong exposure? Is it because of exposures during later stages of the life cycle? We don't even know any of that. We don't monitor ultrafine levels of ultrafine air pollution, which is really the major culprit. These are particles that are nanoparticles, basically. They literally go straight up your nose into your brain, so there's no stopping by the blood-brain barrier. They carry contaminants into the brain. We're actually in the process now of generating iron nanoparticles. Iron is increased in brain in every neurodegenerative disease. Is that because you've been breathing up ultrafine particles all your life and the brain doesn't have a really good way of eliminating iron? So there is much, much, much to be learned. This is really in its infancy, this literature. And I would suggest that studies that don't show associations, it may be because of differences in the chemical composition of the air pollution in some areas versus others. And so it might be a way to start thinking about what are the really bad actors within that chemical composition.
So, I have one. Me?
Yeah.
Okay. So, yeah, this is really just fantastic. And I was just thinking about something. I'm going to have to give a short talk later on, but I wanted to say something now because it's so relevant to both Drs. Roberts and Cory-Slechta about what they were saying. So I'm a director of an office on the exposome, okay? And I have a friend there at NIH that's on health disparities. And we soon got together, because we're both HBCU folks. We soon got together and said, we need to work together. And so we did something on stress, just related to stress. And we got so many applications that we're going to try to keep doing this. We have to work together. That's the thing that I'm trying to say. And I think we're going to be, I think it's starting to bloom at NIH. So I hear you. I hear you. Thanks.
Hope so.
I found the disconnect, actually, you say that, quite interesting when working with the State Agency of Environmental Management, that so the site that's contaminated has soil, air, and water contamination issues, but the State Department of Soil contamination on that site doesn't necessarily talk to the water department about that
Right.
site, who also
Right.
doesn't talk to the air department
Right.
about that exact site.
Right.
It's just mind-boggling to me, and my tax dollars are paying for that.
You know,
So it goes beyond just the, yeah, it's
you're right.
amazing. It's
You're right.
amazing.
we do want to thank the EPA for those chemical policies. And the reason why they were so robust and come in, and thank you, Dr. Freehold, for that, because on the heels of, again, the failure of TSCA for us, we continue to push hard. In the spirit of, I must bring him into this room, Dr. Henry Clark, our beloved Dr. Henry Clark from West County Toxics Coalition out of California. And Dr. Clark left this earthly world a few years ago. And I'll never forget, he said, you know, there's explosions in our communities daily. And I was just thinking about what you said, and I'd like to read that research, because it took it to a whole nother level for me with these explosions. Chevron exploded, 15,000 people went to the hospital, over 15,000 people went to the hospital. And Dr. Clark said they sent him to the hospital, he was included. And they sent him right back home and said everything is okay. Now I'm listening to what you just talked about with the pollution and the nostrils and what have you. And so here's these explosions happening at the fence line. You know, the magic fence that takes care of our people.
It's the property line.
It's not going to go past there. You know it's magic. That's where they got the Harry Potter story from. And so I'm thinking about these things, but thanks be to God for our communities and the workers, because our communities and the workers, as you said, came together, and the advocates, and thankfully we have some of the most robust chemical policy. Now, we still have more to go and we still have more to do, but we're where our communities and workers are saying, this is what we've been talking about. So thank you, EPA.